what is the current business model of physical therapy? Patient comes in, you do an initial eval, you perform a treatment plan, you get the treatment plan on that patient, you proceed with treatment interventions, you do a reevaluation or adjustment of the treatment plan, you continue PT until you end the care. But this current business model for physical therapy, besides the clinical deficiencies that we discussed it may have with the low sensitivities of the various testing you are using during your physical examination, it has a very limited universe of CPT codes that you can bill. So no matter if you do trigger point therapy or manipulation or McKenzie or whatever type of manual therapy you do, you will still bill 97140. So the universe of codes that you can bill for physical therapy is very limited. No matter what type of therapeutic exercise you're going to do on the patient, you will still bill 97110. So let's discuss now about our business model, the business model of HODS that integrates diagnostic testing at the time of the patient evaluation. So before you implement and write and implement a treatment plan, you perform for the appropriate subset of patients diagnostic testing such as EMG, nerve conduction studies, musculoskeletal ultrasound, which guides you to create a more appropriate treatment plan with greater outcomes, greater effectiveness for your patients. We find more than 90% improved patient experience and increased patient participation in the care, and more than 30% increase in the overall revenue that the practice is generating. So we addressed the clinical problem we have with physical therapy private practice. Now let's address the financial problem that exists in physical therapy private practice. Current data indicates that reimbursement rates will decrease for physical therapy until and even beyond the year 2022. Look what has happened recently with Medicare reductions, and many other insurances are following suit Medicare. So it is a ever decreasing type of reimbursement that we get in physical therapy. And that presents a problem because at the end of the day, how much money are you as the private practice owner are taking at home? If your expenses and the salaries you pay to your therapist go up and your reimbursement goes down, how do you pay for that? That cuts down in your profits. You use your profits to pay for the higher expenses with decreased revenues. So you get to work endless hours a week, you bring home less money, and the PPSA-PTA benchmark study showed that nationwide profit margins for physical therapy is 8 to 12%. There is no wonder why when Medicare makes an announcement, either in the past, 9% cut, 8% cut, or in the future, why everybody is so concerned with such slim profit margins for physical therapy. But HODS brings a solution. And what I'm showing here is real numbers for real HODS partners who are implementing diagnostics in their practices. You can see, for example, how without implementing diagnostics, a reimbursement of 85% jumps to $125 or a 47% increase, or a reimbursement even of $93 jumps to $131 per visit, or a reimbursement of $80 a visit jumps to $104 a visit, with increases anywhere between 24 to 40-something% for the practices that are participating in the HODS program. But why? How these practices can get these numbers? Okay, how do they get this significant additional revenue from their patients? Well, here is why. The national average of 1 hour of PT is $97. Of course, if there was a reduction, that would affect it. But even without a reduction, the national average of 1 hour of PT is $97. So the national average for one EMG test is $500, and national average of an MSK ultrasound or neuro ultrasound for 2 units is $200. So what do we have here? On the one hand, you spend an hour with a patient, you make $97 national average. You spend an hour with a patient doing an EMG and neuro MSK, you're making for the combo $700. Diagnostics pay 3 to 10 times more than the average physical therapy visit. And this is how these practices are able to have such significant revenues from their patients. All right. So because of these reasons and to give solutions, we created HODS, Hands-On Diagnostics. Hands-On Diagnostics was created for 4 different purposes: to create a truly autonomous physical therapy practice by advancing the physical therapist as the provider of choice for these diagnostic tests; a purpose to you and your patients to help you, our partner colleagues, offer valuable diagnostic services to your patients and generate significant additional revenues from your diagnostic business; a purpose to the MD and other healthcare professionals community, where we furnish them and their clients with reliable, up-to-date diagnostic testing, and we help them not only get accurate diagnostic results, but we help them improve their revenues too. And I'm going to explain to you how this works. And finally, we are supporting research in diagnostic testing so that we provide the necessary evidence for the proper application and utilization of these testing technologies.